Thanks for joining us at UCSF Health while we discuss general infant formula mixing. We will spend the next few minutes covering the following topics: the importance of proper preparation, considerations such as cleaning and sanitizing equipment, water safety, the types of formula, how to prepare the formula, how to use the formula, storing formula, and frequently asked questions. Proper preparation of infant formula is essential to your infant's health. Formula is specifically designed to provide vital macronutrients and micronutrients necessary for an infant's growth and development. Infant formula is carefully formulated to provide your baby with the nutrition and hydration they need. Proper preparation of infant formula ensures your baby receives adequate nutrition free from contamination. There are a few things to consider before mixing formula. Cleaning and sanitizing supplies is an important step when feeding your baby. It ensures the supplies are free from harmful contaminants. Prior to cleaning supplies or mixing formula, be sure to wash hands and countertop surfaces first. Not all bottles are the same, but most include a bottle, nipple, and ring. Regardless of the parts, be sure to properly sanitize all components of the bottle prior to the first use. If available, utilize the sanitize or hot water cycle of your dishwasher. You can also boil to sanitize. Place the bottle and components in a pot with water, ensuring all parts are covered with water. With a lid on, boil for 5 minutes, then remove with tongs and allow to air dry. You can also sanitize in a bleach solution by mixing 2 teaspoons of bleach with 1 gallon of water. Soak for 2 minutes, ensuring all parts are covered by the solution. Remove with clean hands and allow to air dry thoroughly. Do not rinse after soaking. After using bottles, thoroughly wash all parts in the dishwasher or by hand in hot soapy water, then rinse and air dry. It is important to sanitize feeding supplies at least daily if your infant is under 2 months old, was born prematurely, or has a compromised immune system. Daily sanitizing of bottles and supplies may not be necessary for older healthy babies as long as these items are well cleaned after each use. Another consideration before mixing formula is water. You can use clean tap water or bottled water for concentrated liquid or powder formula. Tap water is typically safe to use, but if you have concerns about the water safety at your home, ask your public water supplier to test your water, or talk to your doctor if you're concerned that your baby has been consuming unsafe water. If you use well water, have the water tested for harmful contaminants if possible. Your local health department may provide a testing service. Otherwise, use bottled water. If tap water becomes unsafe due to a natural disaster or emergency, use bottled water to mix your formula. Now we'll discuss mixing the infant formula. First, let's briefly discuss the types of infant formula. There are 3 options: ready to feed, liquid concentrate, and powdered. Ready to feed formula is exactly how it sounds. It can be fed directly after opening by pouring into a clean bottle. This option is the most convenient and is great for travel, but it comes with a higher price tag. Next, there is liquid concentrate, which needs to be diluted with water. And lastly, the most common and cost-effective option is powdered formula, which also needs to be mixed with water. There are many options for each type of formula on the market. If you are unsure which to choose, ask your dietitian or care provider for their recommendation. Preparing the formula takes just a few simple steps. First, make sure your formula is not expired. If it's expired, don't use it. It's always good practice to check expiration dates when purchasing formula. Next, if your baby needs a specialty formula or a concentration different from standard formula, please refer to the instructions from your healthcare provider or dietitian. Otherwise, always follow the manufacturer's instructions on the container of formula. The amount of formula and water are designed to meet your baby's needs. For both powdered and liquid concentrate formula, measure the exact amount of water required and add it to a clean bottle. You can use the ounce markings on the side of the bottle for measuring. Once the water is in the bottle, add the formula. For powdered formula, use the scoop that came with the formula container and add the appropriate number of scoops into the bottle. For liquid concentrate, pour the appropriate amount into the bottle. Place the nipple and cap on the bottle and shake gently until combined. Avoid using a spoon to stir or a blender to combine, as these methods have been shown to increase the likelihood of introducing bacteria to the formula. Once you mix the formula, you can use it immediately. You do not need to warm the formula, but many people prefer to feed their infant a warm bottle. To warm, you can place the bottle under warm running water, in a warm water bath, or a bottle warmer. Never use a microwave to warm bottles. This method can cause hot spots that can burn an infant's mouth or throat. Be sure to test the temperature of milk on your wrist to ensure it is the proper temperature prior to feeding. It should feel warm but not hot. Formula can be covered and refrigerated for up to 24 hours. Once you begin feeding, use the bottle within 1 hour and throw out any leftover formula, as saliva and formula can quickly breed bacteria. If your baby isn't ready for a bottle, the formula can be held at room temperature if used within 2 hours after mixing. And here is a collection of some frequently asked questions. Do I need to sterilize bottles? Bottles should be sterilized prior to the first use, then thoroughly washed in hot soapy water or the dishwasher after each use. Sterilize more frequently if your baby is under 2 months old, born prematurely, or has a compromised immune system. Can I add extra water to my baby's formula to make it go further? No, extra water dilutes calories and nutrients and can result in excessive water intake. Overhydration and dehydration can both result in hospitalization. Always follow the instructions on your container of formula unless instructed by your registered dietitian or provider. The amount of formula and water are designed to meet your baby's needs. How long can I keep a bottle out at room temperature? Unused prepared formula at room temperature should be thrown out after 2 hours if not used. Can I use a microwave to warm up formula? You never want to use a microwave to heat formula. Hot spots can form when you heat in a microwave, putting your baby at risk for burns. Can I make formula in advance? You can make formula in advance up to 24 hours if stored covered in the refrigerator. I have a question about my baby's formula. Who do I ask? If you have any questions or concerns about the formula you're feeding your baby, ask your healthcare provider or a registered dietitian. And here are some resources for cleaning, sanitizing, water safety, and formula mixing. Thank you for watching this presentation on infant formula mixing.